how movement patterns are forming, these three factors, individual, task, environment, we discussed, and how it occurs. As we all know, how it occurs. The most important slide. I will tell you some story, 2 to 3 minutes of story. You will listen very carefully. Until your central and peripheral nervous system give the signals to your body, you will not move, right? That's why head injury patients are not moving. Agree? Fine. So your central and peripheral nervous systems are the authority. They have key. They have to decide whether to move or not. As soon as brain comes into play, you want to move, do you want to move, also comes into play. Your character attitude comes into play. Belief, character, attitude comes into play. So central and peripheral nervous system given a signal to move you. Move. I started moving. Neuromuscular junction comes into play. The acetylcholine from the axon terminal transmitted to the muscles. Why? Why it has to transmitted? Because it has to simulate the calcium. It has to simulate the calcium. Calcium stored in sarcoplasmic reticulum. So calcium, why we have to stimulate the calcium? Unnecessarily. When you stimulate the calcium, when actin and myosin when bind only can movement happen. Actin myosin bind only can create movement. Then actin and myosin has to bind means myosin was locked with the tropomyosin. Actin வந்து மயோசினை பைண்ட் பண்ணி பிடிச்சி இழுக்கணும்னா மயோசினை லாக் பண்றதுக்கு இடம் வேணும் இல்ல, பிடிக்கிறதுக்கு இடம் வேணும் இல்ல. அந்த பிடிக்கிற இடத்த ட்ரோபோமைசின் கவர் பண்ணியிருக்கும். ஸோ அந்த கவர் பண்ணியிருக்கிற ட்ரோபோமைசினை ரிலீஸ் பண்ணுறது தான் கீ இருந்து கால்சியம். கால்சியம் போய் அந்த கவரை ரிலீஸ் பண்ணிடும். ஸோ அப்போ பைண்ட் ஆயிடும். பைண்ட் ஆயிருந்தா மூவ் நடந்துருமா? ஸோ பேசிக் நம்ம அடுத்தது பிசியாலஜி. பைண்ட் ஆன மூவ் நடந்துருமா? அங்கதான் வராங்க. cardiorespiratory system comes into play. Metabolic system comes into play to produce energy ATP. So as binder, now I need phosphate to create one stroke. So ATP converted into ADP, create a multiple stroke, and muscles get shortened. Muscle gets shortened. Movement another clear. Then muscle gets shortened, it transmits the force to tendon. It transmits the force to tendon. Tendons are attaching to the bone. Bone attaching to the another bone by forming a joint. புரிஞ்சா? போன் வந்து இன்னொரு போன் கூட அட்டாச் ஆயிருக்கு, ஜாயினை ஃபார்ம் பண்றதுக்கு. அதுக்கு பேர் ஆக்சிஸ். அது ஆக்சிஸா வச்சுனா இட் வில் மூவ். சோ இப்படிதான் மூவ்மெண்ட் நடக்குது. from the CNS to cardiovascular, metabolic ல இருந்து musculoskeletal னு வச்சுப்போம். So in there, another important point, if the patient have a central or peripheral nervous system injury, stroke, wrist drop, foot drop, head injury, unconscious, is it person have muscle wasting? Yes or no? Ilkuma? Is that person can move comfortably? So what are you going to do? So central and peripheral nervous system problem ஆயிருந்தா பர்சன் வந்து எதுக்கு வராங்க? என்னால மூவ் பண்ண வைக்கணும்ன்றாங்க. என்னால ஆக்டிவிட்டிஸ் ஆஃப் டெய்லி லிவிங் என்னால பார்த்துக்க முடியல, பார்த்து முடியல வராங்க. So comes under this category. The person have a COPD, chronic bronchitis, interstitial lung disease. The person have muscle wasting? Does the person have muscle wasting? Yes. Person have muscle wasting. The person can move effectively. Cardiac failure. The person can move effectively. What patient's complaints? Fatigue and breathlessness. Also, you have to, the goal of the patient to, without fatigue and breathlessness, want to move well. Live their life. What are you going to treat here? Movement. Once you improve the movement efficacy, definitely breathlessness and fatigue is going to go away. Definitely, we have to address with the fatigue and breathlessness by strengthening again muscle, again a movement, which is called inspiration, expiration, breathing. Okay, we are not addressing the breathing issues by something, IFT or ultrasound. Okay, so the person can effectively develop the force and contract the muscle, and movement can create. I am having a problem on the joint, muscles, or ligaments, skeletal problem. So the person have ACL injury. Does the quadriceps will be very strong? Quadriceps muscle wasting will be there or not? Quadratus musculus இருக்குமா? Quadratus AC range quadratus musculus இருக்குமா? இருக்கும். What do you want to treat? And patient complaints of pain, ankle strain, pain, back pain.
Buckling.
Patient complaints of pain here. Cardiorespiratory patient complaints of breathlessness and fatigue. Neural patient can't complain. Patient relatives will complain. About you after 1 year. Still not improved. Because you're lacking basic education at the time. புரியுதா? ஸோ இங்கே நீங்கள் கார்டியோவாக இருந்தாலும் சரி, நியூரோவாக இருந்தாலும் சரி, ரெஸ்பிரேட்டரியாக இருந்தாலும் சரி, ஸ்கெலிட்டலாக இருந்தாலும் சரி, மஸ்குலோ ஸ்கெலிட்டலாக இருந்தாலும் சரி, கைனோசியாலஜியாக இருந்தாலும் சரி, எங்கேருந்து எங்கே வந்தாலும் யூ ஹவ் டு அட்ரஸ் த மூவ்மெண்ட். Patient will come to you only these two reasons. I have pain, I couldn't able to move, or else I couldn't able to move because of pain. These are two reasons patient comes to you. Skeletal, musculoskeletal practice. I have breathlessness and fatigue, tiredness, I couldn't able to move. When I move, I have breathlessness and fatigue, couldn't able to perform the activity. This is the only reason. So addressing the movement always a key if you are a physiotherapist. If the patient come with you with the chest pain ஒருத்தர் வராது, என்ன பண்ணுவீங்க? மயோஃபேஷியல் ட்ரிகர் இருக்கான்னு பார்ப்பீங்க. சொல்லுங்க. Patient come chest pain ஒருத்தர் வராது, என்ன பண்ணுவீங்க? And you found out, the doctor found out there is a 2 block in the arteries. What is the treatment for them? Is it treating chest pain with IFT ultrasound? Is a treatment for them? What if happens IFT ultrasound with pain treatment? Anytime, any weekend. So நீங்க என்ன ட்ரீட் பண்ணணும்? நீங்க கண்டுபிடிச்ச ரூட் காஸ். நீங்க என்ன பண்ணிட்டு இருக்கீங்க? If you are treating pain with these modalities, you are modulating the symptoms, not treating the problem. You are modulating the symptoms, you are not treating the problem.